Most people focus on the cost of healthcare, but that's actually the wrong area to look into. The movement that's actually subtly happening is the fact that people are now expecting you to take on the healthcare itself. So employers are pushing insurance onto you. Hims and hers is coming out and saying maybe you should be doing your own lab tests at home. Things that take away from the health insurance costs and put them directly on you. We're going to discuss this further on this episode with Kate Woods. In this episode, I interview Kate Woods and she interviews me on the future of health insurance, covering employer plans, AI's impact, and regulatory challenges. So what are we going to discuss? We're going to talk about, is the US healthcare system changing? How can business owners afford health insurance? What are the healthcare costs of a company? How to manage state-specific registrations? How can new employees choose their health insurance? What is AI's role in health insurance? The movement towards patient-empowered healthcare, Hims and Hers Health's latest acquisition, and how empowered should a patient actually be? Our guest again, Kate Woods, Chief Legal and Compliance Officer at ICHRA Dermatology. Let's get into it. Kate, it's been a while. It's so good to see you.
So great to see you as well. Welcome back.
Thank you. We are in the middle of chaos, and chaos hasn't stopped in a while. With the Trump administration coming with all these big changes, and all of us having to go, okay, what does this mean for us? One of those things that it means possibly is the idea that we as patients need to take charge of our own healthcare. We as business owners need to take charge of our own healthcare. What's your take on that so far?
For the past 50 plus years, the majority of Americans have relied on employer-based healthcare, and not to use an inflammatory word, but maybe abdicated some responsibility for control of our own healthcare, or certainly didn't think about it. And now there's a shift. And the shift, I think, really started under the Obama administration and the Affordable Care Act, and thinking about how do you make health insurance, and I'm using that term very specifically, health insurance portable, so that people don't get into situations of, pre-existing conditions, and they're at the mercy of certain decisions their employers make due to the ever escalating costs of healthcare. And so the idea, like one of the great ideas behind the ACA, was to empower individuals, you and me, to be responsible for our own healthcare decisions, and health insurance to be what it is, which is a risk sharing and a risk mitigation strategy.
I'm going to challenge you on that. And the reason I'm going to challenge you is it feels like we're giving way too much credit to the Affordable Care Act, because that was 15 years ago.
Yeah.
And that was 3 administrations ago.
The point I was trying to make was it was the germination. It was the start of a journey that I think we're on. And we're seeing now be further advanced, for good and for bad, through multiple administrations, and by corporate America itself, because employers are saying healthcare costs are no longer sustainable. They go up 11%, something like that a year. And employees don't always understand your costs are going up, but so are your employer's percentage. Now, and frequently employers will pick up a significant portion of a health plan cost, and that's unseen to most employees.
But like you talk about pre-existing conditions, but I'm thinking about myself. When I started, I was a solo business owner. And one of the things I struggled with was, how do I afford my own healthcare? But you're saying things have changed, or we simply don't know the options. So talk me through those options.
I think it's a little bit of both. First of all, I think things have changed. I think there are options that we don't understand. I mean, let's be honest. When you were an employee and you had your 3 options of employer selected health plans, did you really understand any of them? Or did you go, you know what, I can afford to take X dollars out of my paycheck biweekly, so this is the one I'm picking?
I've been general counsel for a company, and I saw what my company's healthcare costs look like divided between the employer and the employee.
Yeah.
In your case, you've worked with various companies in that type of role. How much are employers picking up compared to employees? Obviously, the percentage differs company to company. Patients or employees right in thinking they're picking up the major chunk?
It's a false understanding on the employee side. And I am an employee myself. So I do understand whatever percentage you're picking up, the impact to your paycheck is a real thing. What I think most employees don't understand is that many employers are picking up 50% or more of the health plan costs. There's a new model. Again, the idea behind it originated under the ACA, but it is only now becoming to be more adopted by employers, and it's called ICHRA, and that stands for Individual Coverage Health Reimbursement Arrangement. And what it effectively does for employers who decide to go down that path is it removes the group insurance plan. At its simplest form, what an ICHRA does is it provides an avenue for each of those employees to select individual health plan.
As a lawyer, we're both lawyers, and we're now
Yeah.
talking about employees in different states. Do you now have to register in those different states because your employees are there? Or is that irrelevant because your place of doing business is still only, say, either Pennsylvania or New Jersey? With remote employees, does this become hugely problematic because now you're saying my employees are in all these different states?
That's a conversation around like nexus for the employer and taxes. For health plan purposes, I would think of an ICHRA like the marketplace, like the exchange.
Right.
I don't need to have a brick and mortar as the company
Right.
in Idaho. I need to have an
Right.
employee there. And I'm saying, Kate lives in Idaho. We have an ICHRA. Kate needs to get insurance. She's allowed on that platform. So I think you have valid questions around multi-state
Right.
companies. I don't think they impact ICHRA in that particular way. Well, if you have an employee in Pennsylvania, like she's not necessarily going to come up to New York
Right.
for her care.
Right.
But national health insurers, or the Blues, who are an association of about 36 independent insurers, have networks and platforms. So that's really just about what their network is.
Okay. Well, employees are saying risk is being foisted on me. The last time you guys did this, you put pensions on me, and now I'm stuck with a 401k. Now you guys are foisting the health insurance on me. And I'm curious what your response to those employees are. I'm talking to 22-year-olds. You'd mentioned your son to me a while ago and how he was trying to navigate this, and you were helping him, but you were there to help him. What about that new 21-year-old, 22-year-old who doesn't know what they're walking into?
As an individual consumer is what I would encourage anyone, my young son included. The punchline to my son's story is he was turning 26 and had to pick up his own insurance. Moving down that path, he was going to select a plan that made sense for him financially.
Right.
And I'm his mother, so I want him to have some risk mitigation, because that's really what insurance is in its classic sense, is risk sharing and risk mitigation, which I think we've gotten far away from in the past 60 years in America, where everyone thinks, oh, I have insurance, I should never have an out-of-pocket cost. And I think we have to shift that. We have to go back and reshift our thoughts on what insurance is and isn't.
I think AI is going to land up playing a really big role, where you can now take those documents that the Blues give you and put it into a chat GPT, for argument's sake, and go, tell me what this means for my doctors. Which plan should I choose? What is your take? Do you think AI is going to play a role in that?
I think AI is going to play a role in everything that we do. It just seems to me that we need to be wary and careful that we don't turn AI into a god.
I'm going to respond to you in 3 separate ways, because that's what you've done. You've created this, you open up this Pandora's box of AI, which is very relevant to right now's question. Number one, I think to your point that AI is not a god, 11 states just came out and they're saying, Arizona being the latest one of them, saying that AI is not a god. Don't trust AI. It's illegal, potentially illegal, to use AI to evaluate healthcare claims made to insurers. The second thing to look at is, you said it's just an algorithm following an algorithmic function. Someone told me about this prompt and I looked at it. The prompt went, ask the AI 5 things about you that you don't know about yourself. Or ask it for feedback that's really hard on you. And it gives you that. And you read that going, oh, crap. So you know me really, really well. Now, I've done this with friends and I've suggested that they do it, and they don't get results as good as me, which suggests that I need to stop being as effusive, as open.
Don't be so open with Al.
Exactly. So that's the second comment. But
while humans are looking at the insurance companies' medical decision-making policies and all of those things to approve or deny a claim, there is still a human component to it. And if you can get to the right person, you can appeal.
the one thing you did want to talk about was the hims and hers situation.
Yeah.
Tying it back to ICHRA, tying it back to taking control of your own healthcare.
Again, this is my perspective, having been in healthcare now for quite some time and being passionate about it. And what I think we're seeing. So Hims and Hers has recently acquired an at-home lab testing company so that they can, for their consumers, right? And that's a direct-to-consumer business. They can further advance the healthcare options, and they're now at a cost, right? It's for people who can afford it. Setting aside that corporate America's number one focus and reason for being is to make a profit, which I don't think is a bad thing. What we're seeing is more direct, individual, in your hands decision-making and responsibility. If you look at where for-profit companies are going, right? I'm giving you access to more easily get your blood work, more easily send it to a healthcare provider so we can discuss it via telehealth, which I will say is all technology in support of healthcare. So I'm not against it, right? I'm very much an advocate for using technology to advance healthcare and make it easier for humans. We just need to be careful. All of those things are happening, and most of them, the way they're happening right now, is it's self-pay out of pocket. Because if we step back and get really quiet for a minute, I think what we're seeing is the demise of employer-based health care as the way a majority of people in this country access it.
You're talking about Hims and Hers is a great example. There's sort of this company that fits in the middle of regulated industries that are regulated in very specific ways. You've got the pharmacists who are saying, I'm dispensing. You've got the manufacturers who are saying, we're just making. What happens if you're not making enough and I still need to dispense? That's where Hims and Hers comes in. And there's a very valuable value, if you will, to something like that existing. But you also have companies that don't do it right. You have companies whose tests are shoddy. You have companies whose compounding doesn't meet standards. You have 100%. Companies that are making inappropriate claims. But my point is, we're talking about the empowered patient. How empowered can they actually be? And I don't know if it's fair to empower someone so much and then say we need a learned intermediary in there as well.
Okay, here's what I'm going to say. My mother always said, don't use the F word.
Okay.
Right? I said, oh, okay, the F word. What's the F word? Fair. Fair is the F word.
Ah, okay.
Four-letter word. You shouldn't. I would say, oh, it's not fair, right? Somebody got something I didn't get, or I was punished for something my brother had also done, whatever the case may be. But what I'm saying is, okay, if that's what's going to happen, or not, right? Some of it's perspective, is take what you can, learn what you can, and make decisions in that. But I'm also super, super, super really trying to say to people, again, from my perspective and experience, is that we should all start to separate our health management from health insurance. It is insurance. And insurance, like car insurance isn't car maintenance. No one thinks that. And I'm saying everybody needs to start understanding that at whatever level they can understand it. Like, start where you are. Don't worry about where you're going to get to. Start where you are, because this is coming. Money doesn't lie. And the money is telling us current funding of health insurance isn't sustainable.
I'm going to let you have that last word. And Kate, we're going to do this again soon. And there's so much more to talk about. So thank you for coming on. We're going to do this again.
Yeah, I love it. I always love talking to you.
Call click or email